If you are sick, stay at home. Regardless of what your job is, regardless of how essential you are, when you go out and you're sick, you will infect other people in some way, shape, or form.
Hi, I'm Bucks County District Attorney Matt Weintraub. Today I'm with the Director of Public Health in Bucks County, Dr. David Damsker. Dr. Damsker, thanks for joining us today. Today it's obviously very important, it's on everybody's mind, how to handle COVID-19, the coronavirus, what's safe and what's not safe. We understand that you'd like to give the public a message about what they can and can't do, what's acceptable behavior, and how they can get a hold of you if they need to. Would you like to first let us know what is safe as far as the public's behavior outside?
Yeah, there's a couple things. As we know, this virus tends to hit the elderly the most. So people that are older, over the age of 60, people with underlying medical conditions, those are the people that need to be a little bit more careful even. If they do need to go shopping for food, which is fine, they need to go out, try to do it at off-hour, peak times, go through the self-checkout, those kinds of things. And you could argue that it's good for anyone to do that. If you're not working in an essential job, if your work is closed down, we obviously advise you to stay home as much as possible, but we also want people to feel like they can go out and get some exercise. So we want people to take walks, do what you have to do to keep your mental fitness and your physical fitness up as much as possible. Stay 6 feet away from other people while you're doing it. But it's very, very important. I think people that sit in their homes 24 hours a day for days on end can develop anxiety, reading social media, watching the news. We want people to be mentally healthy as well. So that does involve getting out and doing some things that are safe.
That's great. Now, we've heard a lot about this term, social distancing. Obviously, that's a way that we can keep healthy but still be able to live our lives. Can you explain what that actually means and whether that's something we should practice?
Yeah, social distancing in this context with coronavirus is about 6 feet. That's because the virus is spread via coughing, sneezing, and the average droplet can't go further than 6 feet. So if I cough or sneeze, that droplet goes in the air and goes down in about a 6-foot radius around your body. So if we stay 6 feet away from everybody in the area that you're in, you won't theoretically get sick from coronavirus because they won't able to be infect you if they cough or sneeze.
We've also heard varying numbers of how many people can be together in one location. Do you have a recommendation or advice, or is this something that we should consult the CDC on?
Yeah, the number went from 50 to 10 just in the last couple of days. President Trump mentioned 10, and I think that's a guideline. I think that if you have 9 or 11, I don't think people should get focused on that number as much as just being in smaller groups. And when you're in those smaller groups, if you're sitting tables like we are, we're sitting 6 feet away from each other. This is what I want people to do when they're in social situations. There's no reason to get close. Whatever you can do to maintain those distances in whatever size group you're in is important. But obviously, it's very difficult to maintain those kinds of distances when you have 100 people in a room. So that's why I don't get caught up whether it's 5 or 10 or 20. It's just a matter of the idea behind why we're trying to do it.
And are there just some very general practical tips that people can employ to maintain health during this time?
Yeah, we talk about the real common sense stuff. People sometimes get tired of hearing about it, but that's what you have to do. The most important thing is don't let you or your family member go anywhere while you're sick. If you are sick, stay at home. Regardless of what your job is, regardless of how essential you are, when you go out and you're sick, you will infect other people in some way, shape, or form, whether it's coronavirus, flu, whatever. So we want people to stay home. Continue to wash your hands. Again, these are common sense things. Don't touch your face. Now, if you are out at the store, if you go to Giant and go shopping, and you're touching a cart that feels dirty, whatever, you're touching all the other products. When you're done doing that, wash your hands before you touch your face. It may take a little bit of practice. It may take a little bit of willpower. But even if you have an itch, don't touch your face. And then, anything you've touched in that store won't transfer onto you.
And I understand that you recently, well, I don't understand it, I was there, you met with us in law enforcement, and the whole objective there was to make sure that law enforcement knows what practices and policies to employ so that they can continue to do their job but maintain safety at the same time. I thought that was very beneficial.
Thank you. Yeah, we essential law enforcement, first responders, healthcare providers, we need them to be safe and secure. Without them, we have bigger problems possibly than coronavirus.
And the upshot of that meeting was that law enforcement is going to continue to patrol. They're going to continue to answer emergency calls and be there to serve and protect. To just switch gears real quickly here, is there a way that if people have questions or they want to get more information about this, is there a local contact that they can either contact you or a website they can contact you?
Yeah, check out the Bucks County website, and there's a link to a really nice page that gives a lot of information. You can always look on the cdc.gov coronavirus webpage. There's tons of things on there. If you need someone to speak to, you can call our health department at 215-345-3318. And you can also send an email to COVID19@buckscounty.org.
Okay, I know you've been working around the clock for weeks now, and I really appreciate you taking the time to get this message out to people. This has been Matt Weintraub with Dr. David Damsker, the Director of Public Health here in Bucks County. We may have some more information for you as time progresses, but we wanted to get this out to you. And most importantly, be healthy and be safe. Thank you.